Right. Hey, everyone. Welcome to the Glide to the Finish podcast. Today we have Sarah Ceschin in to talk about common running injuries and how to prevent them or treat them. So, Sarah, welcome to the podcast.
Thanks so much. Thanks for having me.
Yeah, thanks for coming on. And can you start off just by telling us a little bit about what you do and your background in running?
Definitely. So right now I'm a physical therapist. I've been a physical therapist for about 3 years. I did all my schooling back in Wisconsin, and then I moved out here right away because I wanted to be closer to the mountains. But as a physical therapist, you can kind of do a gamut of things, working with different populations. But being a runner, I very much was drawn to working with the active population, specifically runners, because I feel like I can understand runners on all levels outside of just anatomy. And so I've had such a good time being in Boulder. My practice is in Boulder, and just working with the running community. And I didn't grow up running, which is kind of funny. I actually hated running when I was in high school. I did all the volleyball, softball, all those sports. But in college, I did a 5K. I did one of those fun color runs. And it was the first time I had ever run more than a mile. And I was like, that was actually pretty fun. What else could I do? And since then, running has been my life. I quickly got into longer distances, and now most of my time is focused on marathons and ultra marathons because out here, how can you not do trail running? And it's been really fun. So I've been running for probably, that would be 8 to 10 years. And I run with a running group out here in Colorado. I train with the Colorado Harriers, which is a great group. And I just love that the community out here is so friendly and so welcoming. So it's been nice to be able to take my own experiences and especially my own experiences with injuries and be able to relate that into my practice.
Mm-hmm. And what's the furthest you've ever run? You said you do ultras?
Yeah, so I haven't gone into the Boulder, Colorado version of ultras, but I'm just barely skimming the surface of 50Ks right now.
Oh,
so
okay.
Farthest I've run is probably 32 miles.
Yeah.
And yeah, I would love to do more. I'm not sure when the 100-miler will happen, but maybe we'll see.
Someday, it's in the future. I know, living in Boulder, I always feel like I need to, when I tell people that I'm a runner, I'm like, well, but only the short distance is only 10K, because in Boulder, that's a short distance.
But yeah, and not crazy fast. I'm not like the crazy fast human, but
yeah,
just like to run.
Exactly. Yeah. So, I just wanted to hear a little bit, there's some really common running injuries that we see and that people ask me about, or that I see people asking about in Facebook groups all the time. So what do you most often see in your practice, especially with new runners? If there's a difference between experienced runners and new runners, actually, that would be really interesting to hear about too. Especially what do you see with new runners?
I love that question. That's a great question. So it's funny. I always start off whenever I get a runner in my clinic, because I've been there, especially when you're training for something, you get injured and it just feels like your world falls apart. I've been there. It's not fun. And so I start every conversation with new runners who are trying to prevent injury that, injuries are going to happen. We're active people. Especially if you're going out on the trails, your foot's going to find that weird rock and you're going to fall. It's just going to happen. And actually the statistic out there is that 82% of runners, and that includes new and seasoned, 82% of them will get injured at least once. And most of them twice or more. So I always like to tell people, don't be afraid of injury necessarily, because it's probably going to happen. But, it's like anything in the world. You really have to just have the tools in your toolbox so that when you do get injured, you can recover quickly. Or, you have the tools of the inside of my knee hurts or the outside of my knee hurts. It's probably my IT band, or it's probably my something. And so then and you can do the right stretches, the right exercises, fix it quickly, and get back into training. I think is the most important part. So, but to answer your question about the most common injuries, I would say the most common ones are probably plantar fasciitis. Um, and I don't know if people know posterior tibialis tendonitis, which can be confused with plantar fasciitis. All these big terms. So usually when the inside of your foot hurts, getting into your arch, there's a few muscles and a few tissues at play. Um, and so you have to differentiate the two with treatment. Exercises and stretches can look the same, but they are different injuries. So I see those a lot. I see knee pain quite a bit, whether it's coming from IT band or like a patellar tendonitis right underneath the kneecap. That's a really common one also. Let's see, SI joint pain and hip pain is also very common. And typically this happens on one side. The most common thing I do with my patients is I have to realign them in their pelvis. So with a lot of athletes and particularly runners, there's you have your hip complex in your pelvis, and sometimes it can rotate. It's very small, very minute, but it can kind of rotate upon each other. And so what happens with that is if you're a little off or a little rotated, it can make one of your legs a little longer than the other one. Not that you have a leg length discrepancy, but if you think about it, if something rotates, it's going to push one of your legs a little bit longer. And so you'll load it differently. You might load it more, you might load it quicker. And so now all of a sudden, all your injuries are on one side. You know what? Oh, my hip hurts. And that, a few months of my hip hurting, I still run. And now my knee hurts. It's interesting how those happen. So a lot of the times when I get a runner in, I'll check their hips. Even if you have foot pain, I'm going to check your hips, because most of the time it's coming from somewhere up above. And if it's not strong or it's not aligned right, you're going to compensate down the chain, essentially.
Okay.
So yeah, I would say, and that's honestly what I see in new and seasoned runners. I would say the most common new running thing is like foot related injuries, so like the plantar fasciitis and things like that. And that is not only a training issue, but also a shoe issue, right? Because I think as a new runner, it's hard to know what kind of shoe that you need for your foot. And it really does make a difference. So I would say foot related injuries are kind of more new runner injuries. And then in my seasoned runners, probably hip pain, maybe SI joint stuff just from being out of alignment, knee pain too. And, even the most seasoned runner can make mistakes in their training, whether they've trained too hard for this particular race, they put too many miles on too quickly. But I would say that those are the most common ones I see.
Oh, okay. Awesome. Yeah. Yeah, I feel like I hear, foot pain and the hip pain a lot. So for the foot pain, you said shoes are definitely important. What do you recommend that people do for that?
Yeah, good question. And and I think that everyone should kind of check in on their foot position, their foot alignment throughout their whole career of running. When you're a new runner, you probably have a little less stability in the places you need it. Like hip stability, knee stability, core stability. And so that's really going to kind of alter your mechanics and what happens at the foot. So most of the time, new runners probably need a stability shoe. And so, before you get into a big training cycle, I, would go to your local running store like Runner's Roost, Boulder Running Company, and just have someone kind of look at your form, look at your running, make sure you have the right shoe for you. Generally, that's something, like I said, a stability shoe is just going to give you a little bit more support on the inside so that your arch isn't collapsing. And something that's not zero drop, but not a crazy high heel, because that's also going to alter your mechanics. And then something that has enough room in the toe box. So not scrunching your feet together, because that's going to make it difficult for you to activate your big toe, which is very big for propulsion. A lot of the times when our big toe is weak or not being used, that's when plantar fasciitis happens and all the foot stuff happens.
Okay.
And so, but then I always tell people too, your mechanics are going to change, especially as you start strengthening, you're running more, you're going to get stability from strengthening. So you may not need a stability shoe for the rest of your career. So it's always good when you need a new pair of shoes. Don't always go with what you always get because it can change. So,
Mhm.
go in again. A lot of stores do it for free. You could even go to physical therapists. I do a lot of gait analysis and looking at people's feet. And I do free consults. So come in for 30 minutes. We'll take a look at your feet, just see what you need. I always think it's good to do a check-in no matter who you are.
Okay. Yeah, and how often do you recommend that people change their shoes?
Yeah, that's a good question too. And you know what? Rules in my brain are good things to be aware of, but of course everyone's different. And so there's people that after 300 miles on a pair of shoes, that's it, they're done. They need a new one. People can go 5 to 600 miles and not be affected by that. And so it really depends on the person. It also depends on the kind of training you're doing. So if you're putting a lot of miles that are at really intense speeds, high intensity like training intervals and things like that, you're probably going to wear out your shoes a lot faster.
Mhm.
Versus if you're just going easy paces, you're going long distances, but you're not putting as much like impact through the shoe. It's just going to change. So I think generally what I tell people, it's hard to kind of track your miles, but if you do track your miles, and there's things like Strava that help you kind of do that. Start with that 3 to 400 range, and once you're getting to that point, check in. Are you finding that you're more fatigued? Fatigue is a big sign for a lot of things, but are runs getting more fatiguing? Is it getting harder mentally to get through them? Are you starting to feel tight in areas you wouldn't feel tight? I wouldn't say that that's an injury, but if you are feeling tight in certain areas or they're not recovering as quickly, it could be your shoe. Uh, Shoes are outside of our foot and the natural anatomy of our foot. A shoe is going to really help with that shock absorption. So if you're feeling more fatigued or tight in certain areas, your body's probably taking up more of that shock absorption, and it's less coming from the help of the shoe. So it might be a good time to get a new shoe.
Mhm. And it
um,
might also be possible to buy a new shoe at that point and then try switching back and forth between them and see if that is the shoe, you know, how much difference you're feeling between the old shoes and the new shoes. And that can be a really good way to gauge when you need to change them as well.
Yeah, and I'm glad that you said that, because I was also going to say I generally try to tell people that when things are feeling tight or fatigued, you're not injured, but it's a good time, like you said, to get a new pair of shoes. And you never want to go straight into a new pair of shoes and continue your training and try to do that 12-mile long run in these new shoes, because your body has to adjust to this new amount of comfort and support. And so, like you said, that's a good time. You get the new pair and still kind of switch out so that you can ease into this new shoe. Um, yeah.
Cool, thanks. And so if people are starting to feel that first twinge of foot pain, plantar fasciitis, should they stop running? Should they just get a new shoe and try it? What should they do when they start to think maybe that's coming up?
Yeah, that's a good question. So if while you're training, you're starting to feel these aches and pains that are just little twinges, they don't happen through your whole run, but maybe a couple times through your run, you're like, oh man, that felt weird in my foot. I always tell people, you don't have to stop running, but definitely take things down. You know, take it down in speed, in intensity, in miles, even if it's just for 1 or 2 runs of the week. Um, really see how your body's feeling, and then add in, some stretches, some more foam rolling, really trying to feel what your body is telling you. And it will tell you things. You'll get on that foam roller, you'll start doing your stretches, and you're like, holy crap, this hurts. Your body's going to tell you. So people will ask me that question, or tell me like, hey, my last run, my knee started to feel this way. I don't tell people to come in right away. Give your body a couple days, even give yourself a rest day. That's sometimes your body just telling you, hey, you need an extra day of rest. Um, I know I'm guilty of this myself, and that like it's hard for me to take a rest day because I love to run so much. But your body does the most amount of progress. and strengthening during recovery, right? Like those tissues get irritated and they get, broken down or whatever. But those rest days is when you're making the most progress in your training because everything's trying to realign and get stronger and recover. So yeah, if you're starting to feel some of those aches and pains, take a rest day. When you get back into it, do some short little miles at a low intensity and see what your body tells you.
Okay. And are there any specific signs that you think if they come up, people should definitely be getting treatment, going to a doctor or physical therapist?
Yeah, so the pain scale is not my favorite. Like, 0 to 10, how much pain are you in? It's not my favorite thing, but I generally tell people, if it's getting to the point where the pain is noticeable, it's noticeable for the majority of the day, and it's annoying. That's usually where it's like that 4 or 5 out of 10. That's where I would start to go ask questions or see somebody about it. And especially if it's lasting for a majority of the day, you go for your run, you're feeling it in the run, and when you stop running, it's still there, and it's still there for maybe a couple hours. And that includes, you come in, maybe you're not feeling it, but you sit down for a little while, and then you go to stand up, and your knee just is really stiff and painful. That's when you probably need some attention because there's a lot of inflammation and there's some damage going on there that's taking a long time to recover. So that's a good time to go see somebody. If you felt some things and you've given it a week and it's not going away, that's a good time to go see somebody. If there's any numbness or tingling that accompanies it, and that's even, if you're sitting and maybe you're not feeling the pain in your knee, but your foot's always going numb or your calf is numb and tingly, that could mean a low back issue. So that's another sign I tell people, numb and tingly is not always normal. So we should probably get that looked at. Those are probably my biggest signs. So numbness and tingling, pain that's not going away after the run, pain that's annoying and lasts the majority of the day.
Okay.
Yeah.
Yeah, those seem like some pretty good guidelines. So before that comes up, you should be backing off if you're feeling pain, but if it gets to that point, you should be looking for treatment.
Yeah, and backing off, I would say for at least, 3 days or give it a week, give it a full week of like backing off of running, trying some stretches, trying exercises, see if you can rehab it on your own. As much as I'm in the business of helping to rehab people, I always want the goal to be for you to be able to problem solve that for yourself. So I would say try that for, at least 3 days or a week. And then if the pain, the numbness, tingling, if all that's still kind of there, then that's when you should go seek some advice.
Okay. And if people are getting to that point, where do they start? Do they just go to their doctor?
So that's a great question, and it's changed a lot recently, but if it's specific to like a muscle and joint pain, now Colorado is a direct access state. So for most insurances outside of Medicare and Medicaid, I think those are the only two, but even outside of whatever insurance you have, you can go straight to a physical therapist, and just, you don't need a script from the doctor or anything like that. You can just go straight to your physical therapist, a chiropractor. I am also, Joy, I know you're a massage therapist. I'm a huge proponent of someone just going to get a massage first. You can foam roll and stretch all you want, but that's not going to get that deep manipulation of those tissues. So sometimes it's nice to just go to a massage therapist that, like yourself, knows a lot about running injuries and the tissues that are involved in those things. But you don't always have to go to your doctor. And in saying that, if it's something that you're nervous about bone related, like a stress fracture, a lot of doctors or a lot of physical therapists and chiropractors can assess those things and order imaging. So you can go that route because a lot of the times it's easier to get in with those people than it is to schedule with your doctor, as far as getting something sooner than later.
Yeah, and probably especially right now if you live in an area where, so that would depend state by state, right? In Colorado, you're allowed to go straight to a PT, but in possibly other areas, there are different regulations and you have to get a doctor's prescription first.
Yeah, I
Okay.
would say most states, I'm having a hard time thinking of one that's not, but most states at this point are direct access.
Oh, cool.
Um, yeah, so you can always Google that online.
Mhm.
Is my state a direct access state for physical therapy or chiropractic services? Um, or you can call your insurance company, but most states, I know Colorado for sure, is a
Mhm.
direct access state.
Oh, okay, cool. That's good to know. I hadn't realized that that was the case now or how long it's been
Yeah, no,
like
thanks for
that.
asking
So,
because I don't think a lot of people know that it is fairly new, like the past, I don't know, 10 years maybe?
oh, okay, cool.
Yeah.
Yeah. Yeah, so you've mentioned the knee pain. We talked more about plantar fasciitis, but what comes up with people's knees? Because I know that runner's knee can mean a couple of different injuries. What should people be looking out for? What can they do for that?
Yeah, with the knee, it can come from various tissues, like I said. So whether it's coming from like a tightness in your quads, which would be more of patellar tendonitis, whether it's coming from, tightness in your hips and your IT band, which I say with quotes because the IT, it's not always the actual IT band. And so that's just going to create pain in different areas of your knee. So patellar tendonitis is that pain that's in your kneecap or right below the kneecap. IT band is like on the outside of your knee. And then sometimes, whether you have like a little bit of a meniscus instability or tear, or some strain on the muscles along your inside of your thigh, that can show up as pain in the inside of your knee. Honestly, no matter where the pain is, the stretches and exercises look the same for the most part. So you're always going to want to stretch your hip flexors, doing the I'm trying to think of the yoga pose that it is, but essentially you're like in a warrior pose, down on your knee, stretching your hip out. I think you made a really great video of some stretches and exercises, and that might have been one of them, Joy.
Oh yeah, it was a slightly different version, but it was getting at the same thing.
At the hip
So
flexor.
yeah.
Yeah. So stretching your hip flexors out, stretching your quads, and then looking at the strength of your glutes, right? That's like the runner's big problem is glute activation, myself included. Um, and so most of the time that knee is having pain because we're not loading it using our big muscles from up top. And so our knee, by fault, if we can't support it with our glutes, it's going to kind of collapse inward, which is what happens at the foot and creates plantar fasciitis. And so that malalignment of the knee creates instability. With repetition of running, creates pain, right? The tendons and ligaments all kind of take up those ground reaction forces, and that's where they get irritated and they get painful. And so the biggest thing for knee injuries, I would say, is the quad and hip flexor stretching, and then making sure you're always doing some sort of glute um, strengthening. And glute strengthening that happens laterally, which you've given some really great exercises, Joy, on that. Because running kind of happens in this frontal or sagittal plane, I should say. But we really need to strengthen kind of in that rotational kind of lateral plane so that the hips can stabilize the knee um, in that straight plane.
All right. Um, cool, thanks. And then is there anything different or anything to add for the hip pain, like
For
the
the
hip
hip pain,
bursitis, or is that fairly similar with the to what we're doing with the knee and the foot as well?
yeah, that's a great question. With the hip, you're right in that a lot of the exercises are going to look the same for a lot of these because really it just kind of boils down to having mobility and stability first before we ask the body to do all this dynamic stuff. So it's the mobility comes first. So having enough range of motion in our hips, um, which includes stretching your hip flexors, stretching your glutes, stretching your adductors. All that stuff needs to be nice and loose so that you have enough mobility there. And then you have to stabilize everything. And stability comes from the glute strengthening, And core stabilization, I would say people with hip injuries, I start doing the core stabilization a little earlier in the rehab, which is a little different than the knee and the foot. There's some other things I'll focus on with those injuries. Um, and core stability is always in there somewhere. But with a hip injury, I think I go for adding in some core stabilization a little bit earlier in the rehab, because that's what's going to help it realign and have and create stability better. So, doing planks, doing dead bugs, that kind of thing.
Cool. Uh, what was I going to ask? Oh, yeah. And then, so if people have those exercises, either from a physical therapist or just that they're doing on their own, do you recommend doing that on recovery days or doing it before a run? Where do you recommend fitting those into their schedule?
Yeah, great question. At the end of the day, I'll tell someone or ask someone, when do you have time to do exercises? And they'll say, probably right after work. And I'll say, great, that's when you do them. Like, it's always better to get them done than it is to try to force it at a time that maybe doesn't work best for you. So really, whenever it works. And you can do different exercises at different points of your training day. So sometimes there's some really nice like glute activation exercises you can do as a warm up before you run, to get your tissues warmed up, to get the right muscles activated. So you can do a few of those before you even start running as part of your warm up. And things that are kind of easy peasy, nothing that's going to like really fatigue you before you go out on your run. If it's an easy running day, like a recovery run, you've done, maybe 3 to 4 miles at an easy pace, you could throw in some strengthening after that. And you could be a little bit more intense with your strengthening since your run's already done. And then, like you said, too, recovery days or rest days, if you want to get in some of that active recovery, a great day to do strengthening. Because then you can really focus on all the areas of the body that need to be strengthened. It's okay if you fatigue yourself out because it's, a rest day, you're not going for a run that day. However, if you are planning to do a super, super long run, or it's a very hard tempo run or a hard track workout, I wouldn't try to force any strengthening right after those runs or even later in the day. Your body's just going to be really tired and still needs to recover. So I would say the best time to do those exercises is either during easy run days, some activation stuff before you run, or just on days where you're not running at all.
Awesome.
Yeah.
Thanks.
And sorry to interrupt you, but also trying to get some, strengthening in, about 2-3 times a week, I would say, just as a general kind of maintenance.
Awesome.
Mm-hmm.
Yeah. Do you have any other advice that you give to new runners as we wrap up here?
Yeah.
Or anything from your own experience that you think people could benefit from?
Yeah. So, as a new runner, it's such a hard thing, especially I think in our community where running is such a huge sport. There's a lot of different levels and different ideas out there. And at the end of the day, do what's best for you. There's a lot of training programs out there, like online. It's couch to marathon, and it's not always the easy progression that you need to get into that training. And some people's idea is your longest training week is going to be 50 miles. Well, that's not for everybody, especially for your first one. So I think it's always good to reach out to all the resources we have in this community. Find a good running coach that can make you a plan for you. Go see a physical therapist or somebody before you start training to understand where your imbalances are. Like, oh, just by assessing this glute's weak, this is tight, make sure you're incorporating these specific exercises in while you're training. And then always listen to your body. Like if you're feeling tired, if things are feeling tight, but you're supposed to do a 5-mile run today, it's okay if it doesn't happen. Whether you get this 5-mile run in today or not is not going to affect you in a couple months when the race is. You know, one day is okay if you need to adjust, and be flexible with your training schedule. I always tell people too, and that way you can prevent things like mental burnout and overtraining. But I
Mhm.
think it's always good, you know, if you're a new runner, use the resources available to you in our community, like a running coach, a physical therapist. It's cheaper and more efficient to do those things at the beginning than it is to start training, get injured, and have to take breaks from training, spend all this money on healthcare. You know, just do it once before, and hopefully that'll get you through your program.
Awesome, thanks. Yeah, I think that's really helpful for people to hear, is to listen to their bodies and do what's right for them. It's easy to feel pressured to keep up with everyone else, especially when there's so many really intense runners here. So it was
Yeah.
really cool to have that to aspire to as well.
Yes, because that's what also I was going to say too. If you're a new runner, go out and find a running group to join.
Mhm.
It's been I when I moved out here, I joined, you know, just a casual run. It was a 3 mile run, then we got beer afterwards or whatever. And it was the best thing that I ever did. And having a community of runners or friends to, you know, do long runs with, people that are at your pace, it just makes the experience that much more fun.
Yeah.
Yeah.
Well, thank you so much for coming on today and
Yeah.
sharing. I think that was really helpful.
Thank you too. This has been really, really great. Thanks so much.